welcome. You're watching Health and Wellness. I'm Rishika Barwa. Life, of course, is very precious, and the sign of being alive is the continued pumping of your heart. When your heart stops beating, you can get into a cardiac emergency situation. A medical emergency may occur at any time to any person, and as per the WHO census statistics, mortality due to cardiac causes has overtaken mortality that is caused by all cancers put together. The concerning change in the recent times is that the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is the lack of awareness as to what needs to be done in a cardiac emergency situation. Now, every adult should know which conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand the actions that are required in case of a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life. It's been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease. As research reports, that the majority of cardiac arrests can occur at home. Save a Life is an initiative through which people can be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand the sudden cardiac death and the role of CPR to revive and save a life. Dr. Aman Sinha, consultant cardiologist, Shubhakama Heart Hospital, Gaya, is joining us. We also have Dr. A.K. Trivedi, interventional cardiologist from the Regency Hospital in Kanpur. Appreciate you, doctors, for being with us. Dr. Sinha, to you first. Cardiovascular diseases are a group of disorders that affect the heart and the blood vessels. Which cardiovascular disease is the deadliest according to you, and why?
According to good afternoon, everyone. According to me, any pathology inside the heart is not good, whether it is related to valvular heart disease or myocardium, which in due course of time can lead to heart failure. But by far, according to me, the most deadliest one is coronary artery disease, in which there is a deposition of cholesterol layers inside the blood vessels, which, if left untreated, can lead to heart attack. So a person loses his or her family member in a very short amount of time, because in heart attack it has a very wide spectrum. It can lead to simple feeling of chest pain, chest heaviness, to becoming rapidly fatal within 2 minutes. So a person can lose his or her family member. There is a lot of financial and emotional burden associated with it. And the second thing is that there is no provocative sign. Most of the times there is no provocative sign or symptoms associated. Third is the health system. I mean to say that the basic needs, the equipment which is required to save a particular person is only considered at particular hospitals. So by the time the person reaches to that very center, he has already wasted a lot of time, which can put his or her life in jeopardy. So coronary artery disease is by far the most deadliest one, because it can become very fatal in a very short amount of time. And many times a patient does not realize that he or she is having heart attack, because they can ignore the symptoms like a feeling of gas or choking sensation over the chest area, chest heaviness. So lack of awareness is also there. Because of that, the patient reaches to a particular doctor after like wasting a lot of time. So according to me, coronary artery disease is the most serious and the most deadliest of all. Thank you.
All right. Well, that's really important information for our viewers. Dr. Trivedi, what are some of the common risk factors that are associated with cardiac disease in general and with heart attacks in particular?
Thank you, Rishta, for asking this very important question. As far as common risk factors are concerned, I'd like to mention that the most common and most important is a use of smoking or use of tobacco in any form. Yeah, because that is started even at the young age. So it's very important risk factors. And the second important risk factor is a high lipid in the blood, means high cholesterol or even triglyceride is also important. So the cholesterol should not be high. And the third risk factor is increased blood pressure, or we call it hypertension. So once the hypertension is there, is another risk factor for heart disease. Heart disease means we are talking about coronary artery disease, it means blockage in the heart. Then the fourth one becomes a very important one is diabetes. If somebody has a diabetes, he's more prone for heart disease. And one more important is genetic factor, means if there is a family history of premature heart disease, or my parents or brother or sister, they have a heart disease, it means that particular person, even at the young age, he's prone for heart disease. So family history is very, very important. It's very important risk factors. And then lack of physical exercise or physical activity is also called a sort of a new smoking, means it's as important as the use of smoking. So physical activity is very important, and it becomes a very important risk factor. As far as the risk factor for heart attack is concerned, there has to be some underlying heart disease in majority of the patient, and the risk factor for heart attack in heart patient may be acute strenuous exercise, or acute stress, or persistent stress for a long time can lead to rapid development of heart disease and lead to heart attack. Or even sometimes heart attack can be there without any warning. So risk factors has to be controlled if somebody wants to prevent heart disease, coronary artery disease.
Right, a very important perspective there. Dr. Sinha, most people are not aware of the difference between heart attack and a sudden cardiac arrest, which may lead to mistakes in, perhaps identifying the symptoms. How do you know if it is a primary cardiac arrest?
These two things are very different. First of all, heart attack is something which is a long process. I mean to say that there is a deposition of cholesterol inside the blood vessels, which can, in due course of time, can lead to demand supply mismatch, because the blood vessels are supplying to a particular area of the heart. So because of that, there is demand supply mismatch, and which can lead to chest pain, angina, and if left untreated, if ignored by the patient, can lead to heart attack in future. Second thing is the heart attack. Second thing is the if the cholesterol, whatever is deposited inside the blood vessels, it becomes rapidly fatal. Second thing is cardiac arrest. Cardiac arrest is something which is electrical disturbance inside the heart. So we have to understand that heart is a pumping organ which has a lot of electrical network inside that. So whenever a impulse comes, the heart pumps. So whenever there is difference between there is a problem in the conduction of impulse, the heart can beat at a very rapid rate, or it can beat at a very slow rate. Because of that, the pump failure will get disturbed. See, our brain, our kidneys, our muscles require blood all the time. So even if the pump failure is disturbed for even like 15-20 seconds, the patient can become unconscious within 2 to 3 minutes. And cardiac arrest is something in which a patient lands up in emergency in an unconscious state with profuse sweating. There is the pulse is not palpable, and we have to do something immediately. We have to do intervention immediately so as to save the person. Heart attack is something which is a long process in which the patient can have chest pain, can have burning sensation, breathlessness, anxiety, and a lot of other things are there in heart attack. But cardiac arrest is something which is very serious, rapidly fatal in 2 to 3 minutes. Patient comes in emergency unconscious. He doesn't walk by himself. He is brought by someone, and it is very fatal. So both things are very different. Heart attack is chest pain. The patient can come to OPD. The patient can come to emergency, but the patient is conscious. In cardiac arrest, there is electrical disturbance. Now, this electrical disturbance can be because of many things, like pre-existing heart condition. Second thing is lack of supply to the heart muscles. That is, acute heart attack is also a common cause for cardiac arrest. Third is there is electrolyte imbalance, that is sodium potassium imbalance inside the body. So, a lot of things are associated with cardiac arrest, and it is very fatal.
Right. Also joining us on the show, we have Dr. Niraj Kumar. He's a consultant cardiologist from the Meher Polyclinic in Agra. Thanks very much, doctor, for being with us. I want to also ask you, in the light of the fact that even younger people these days are getting cardiac arrests and heart attacks, at what age should people really begin screening for heart diseases, and which medical tests are advised in order to diagnose heart conditions?
Thank you, ma'am. Thank you for inviting me and giving some lights on the subject. So, India is basically known for having pandemics of heart disease, including the heart attacks, including the diabetes or the all. So it's always advisable to have a regular checkup so that we can detect earlier and can prevent the acute heart attack or sudden cardiac death. So the recommended routine examination is for cholesterol it is around 40 years of age, and for blood pressure it is around 35 years of age. So every person after crossing the 35 years of age should get his blood pressure checked at least annually. And if the person is having some risk factors like diabetes, CKD, chronic kidney disease, or diagnosed as an hypertension, then checkup should be more frequent than annual. And the cholesterol level should be checked in asymptomatic patient at the age of 40 and should be repeated regularly after say, 5 years of age. 5 years if the cholesterol level is normal, and be screened more frequently if there is other factors such as again diabetes or patient previously having heart attack or having throat LV infection, and patient is having on some stents put on, or chronic heart failure, then this need to be investigated more. Okay, ma'am.
Right. Dr. Trivedi, survival from sudden cardiac arrest is possible with fast and appropriate medical care, presumably. How soon should CPR be started after identifying a cardiac arrest, and what should a person do before beginning CPR?
Thank you, Rishika. The CPR should be started as soon as possible, and it should be preferably within 3 minutes, because if 3 minutes are passed after a cardiac arrest, probably brain may remain damaged permanently. So it should be as early as possible, maybe possible within seconds, CPR should be started. And before CPR, you have to see that the patient really needs CPR or not. To confirm that, we have to see that the patient suddenly becomes unconscious, and you have to watch his chest, his or her chest, and you see that he's not breathing, his chest is not moving at all. Pulse is usually a pulse is always absent, but a common man, if he is non-medico or not a paramedical staff, he can't examine the pulse. So we don't give too much emphasis on pulse unless he's a medical, he's in the hospital or somewhere. So watch for breathing. He's not breathing and he's unconscious, not responding to your stimuli. Immediately lie him on the hard floor and then immediately start the CPR. And in the meantime, call for the medical help so that he can be either shifted to a hospital, or a medical help can be available then and there, and patient could be revived by giving a external defibrillator.
You know, so much has been talked about CPR. Dr. Niraj Kumar, just the basics. Can you explain the process of CPR and the things to remember while giving CPR?
Yeah, ma'am. It's very important to know the exact process of CPR. In a estimation, the 98% of Indians do not know exactly how the CPR should be performed. Okay? So, before starting CPR, we should be aware of that patient is unconscious and check the pulse. If the pulse is absent, then we should start CPR immediately. Okay? 1 minute delay decreases the 10% survival rate. So we should start CPR as early as possible after detecting the only two things we need to check. One is the patient is unconscious, suddenly unconscious, and second, that there is no pulse. Then we should start CPR. CPR should be started on a flat surface. It should be given on the distal 1/3 of the sternum, and the compression should be at least 100 to 120 per minute, and it's firm so that the bone should be compressed more than 5 to 6 centimeter with each compression. And just we have to release the pressure so that the chest recoil fully, and then again give firm pressure. And the pressure should be say around 100 and 120 per minute, and it's not bending from the lower half of the
right.
upper half.
Right. All right, on that note, we're going to slip into a very short break, but our panel of expert doctors will continue to be live with us on the other side. Stay with us. Welcome back. You're watching Health and Wellness. I want to now go across to Dr. Sinha. We're, of course, talking about the CPR. And as we've discussed, CPR is a life-saving technique. Will CPR always be able to save a life? Is it a sure shot, Dr. Sinha?
Ma'am, it's a very good question, but unfortunately, the answer to this question is no. We have to know that cardiac arrest can be in hospital setting or it can be out of hospital. So, in hospital setting, the chances of the patient surviving the cardiac arrest is high because we have all the necessary and the necessary drugs. We have the medications. We have the shock, that is defibrillator. We have trained and personal. We have doctors also, so we can identify the cardiac arrest as soon as possible, like in 10-15 seconds. We can identify, we can treat the patient, we can start CPR with all the basic protocol with the ACLS rule, and we can save the patient and we can save the patient. But out of hospital cardiac arrest, there are few things involved. That is, in normal society, in villages or in normal town, people don't know that this patient who has become unconscious is because of cardiac arrest. People will start. They don't know how to deal with this cardiac arrest. They don't know what to do with cardiac arrest. Third, they will start to carry the patient to a nearby hospital instead of giving CPR. Fourth, we don't have defibrillator shock giving machines. We don't have essential drugs. We don't know how to give proper CPR in a village setting or in town setting. So, out of hospital cardiac arrest is very dangerous. It is very fatal. But in hospital, we can still save the patient because we have all the necessary drugs. We have all the necessary medications. We have trained personnel staff. Out of hospital, it is very dangerous. But still, we don't have to deny CPR to anybody. If we don't have anything, something is better than nothing. We can still go ahead with giving chest compressions, even if we don't have all the drugs. And by the time any healthcare facility arrives, or we can take the patient, we can carry the patient to the nearest healthcare center.
Right. You know, Dr. Trivedi, almost every person nowadays has at least one person in their family who has a history of cardiovascular disease. You know, how important is it for patient caregivers and relatives and family members to learn CPR?
Actually, in majority of the cases, we see that the cardiac arrest is out of the hospital situation, maybe in any crowd, or maybe in the mall, or maybe in the hospital, maybe school, because it can happen even in younger, older people both. So majority of the patient will be out of hospital. Therefore, medical and paramedical staff will not be available there, because unless he's in the hospital, the immediate facility is not there. So out of the hospital, CPR is required by bystander, and everybody in the population should know how to do the CPR. It is essential for everybody, particularly all family members, because sometimes the only two family members, husband and wife, is in the house, and a husband gets a cardiac arrest. Wife must know how to do a CPR, so medical help can be available there, or he can be shifted, continuing CPR, to a nearby hospital. So, in my opinion, everybody, all adults, should know how to do a CPR, so that some of the lives can be saved out of the hospital.
Right. Dr. Kumar, the majority of us don't know the exact technique of CPR, and there's always a fear that they could get involved in, you know, a legal sort of a proceeding. Is CPR therefore legal in India? What's the legality of the issue?
CPR is totally legal, ma'am. Or even during the CPR, there might be chances of the rib fracture. This is also illegal, and there is no proceeding for the rib fracture if it at all occur during the CPR. And CPR also to the opposite gender. Usually, the people hesitate in doing the CPR of female, at least especially in public places. But this is not illegal, and this should be done to every patient, whether it is male or it is female. If you are alone, Just do chest compression alone, and no need to give mouth-to-mouth respiration. And it should be given to all. The percentage of CPR to the female, those who are outside the house or the hospital, is very less, and it should be discouraged. Okay, ma'am.
All right, very, very important points there being made. I think a lot of you have made important points which will perhaps go a long way in saving a life. And I think that's really the purpose of this, to educate people on what they can do. Thank you, doctors, very much for joining us.